Hi there, and welcome to this week's Social Life and Peel's Shape Up episode. I'm here with Dr. Jade, who's a chiropractor. Welcome to the show.
Thank you for having me.
So let's get right into it. Why should somebody see a chiropractor? What are some of the benefits?
Well, the thing with chiropractic is it's non-invasive, it's hands-on primary healthcare discipline where it deals with your musculoskeletal system. So that basically means we focus on conditions with your muscles, ligaments, and your joints. And we can diagnose, we can provide manual treatment, preventative care, and even come up with management strategies with any conditions that you're having with your body.
And walk me through an initial visit with you.
Okay, so initial visit would probably take longer than your usual treatments afterwards, because you'll walk in and hopefully you'll be wearing comfortable clothes because you'll be doing some physical examinations where you're probably going to be put into different positions, trying to test out the pain that you came in. So first off, before the physical examination, there's actually more of like a historical, like trying to figure out what happened, what your pain is, figure out the location of it, how it happened, things like that. And then after that, they're going to perform the physical exam. So that's when they're going to try to go through testing, muscle testing, range of motion, neurological testing to see if they can recreate your pain. And once they can do that, then they will have an idea of what you have. Okay, and then they'll come up with, they'll let you know what you have, and they'll educate you what you have. And then they'll come up with a strategy, a treatment plan for you.
Okay.
Yeah.
And you also mentioned to me that one of the most common problems that people come to you with is lower back pain.
Low back pain.
So what are the causes of this?
Low back pain, the thing is, your back is probably one of the most important parts of your body. You don't realize it until it starts hurting because you use your body right when you start sitting up, when you're a baby. When you start running around, you're walking, you're using your back every day, and you don't realize it until it starts hurting.
Right.
So it's important because, again, it's from everything from your posture to your balance when you're walking, you're running, supporting your arms, your legs, everything. And it's important nowadays because like a typical working population is usually behind a desk, right? You're in the computer, you're texting. Yeah, a lot of people, I'm getting a lot of patients now with upper back pain because they're texting a lot and their necks are this. And then their laptops are lower, right? Most of us are using laptops now, not the desktops where you can actually move your screen higher, your monitor higher, so you have more of a chin to the floor is parallel. Okay. So you're getting all that, and if you're in one position for too long, that's when you cause injury and strains to your back, and that's when back pain starts.
Okay. And what are some of the differences between you and a massage therapist?
Massage therapists, they do mostly soft tissue, like they would they would focus on muscles mostly and kind of stripping out the muscles and doing more soft tissue work, and it usually the amount of appointment time is usually within an hour or so. Okay. With the chiropractic we do soft tissue treatments, but not as much. Usually we do soft tissue treatments to kind of loosen up the muscles before we do an adjustment. Okay. Yeah, or mobilization of the joint.
And an adjustment, it sounds kind of scary. Is it safe?
It is safe. I know there's a lot, like you mentioned. Like you mentioned before, right? I know we see it on TV, people kind of going crazy with
those kung fu movies. Exactly. They kind of snap your neck.
Exactly. It's not like that at all.
It's not like that. Okay.
Chiropractors, we are highly skilled in making sure that when we're performing an adjustment, it is safe, it is controlled. It's controlled and just enough amount of force to induce that motion in your neck. You usually need an adjustment because something is stuck. Okay. Like your joint is stuck. It could be because your muscles are so tight. It could be that your joints are a little there's inflammation there, that the joints are stuck. So that's what an adjustment do. It induces motion on your joints.
Okay.
And yeah, it shouldn't be that crazy kung fu thing that you see on TV.
Well, that's a relief. Yeah. So when you do a neck adjustment, that also helps other part of the body. So how does that work?
It's just the feeling of having the adjustment after, because it really kind of gives that relaxation into your muscles, and it's different for everyone. Some people will feel the relief right away, some people won't. Different people are different. So it just has that feeling where all your muscle will, once an adjustment happens, your muscle will start relaxing, and it'll just have that feeling.
Okay. And the way that people go see their medical doctor for their checkups once a year or whatever it may be, is that the way that they should see a chiropractor? Or do you need a referral from an MD? How would it work to come see you?
You don't need a referral from an MD. You can just walk into a chiropractic clinic and ask for an appointment, and that's pretty much it. In terms of the treatment plan, it'll depend on what you have. One thing that's great about chiropractic is that it's personalized. Somebody who has more of an acute injury, they might see the chiropractor more within a span of a week. Somebody who has more of a chronic back injury, let's say they've had this back injury for years, and it's up to you, really. It depends on how you feel, and you'll talk to that with your chiropractor to see, like, maybe I need to see my chiropractor maybe once a month or twice a month to kind of have that tune-up that my body needs, and you'll feel it, right? You'll feel the difference after.
And when people get into car accidents or whatever it may be, sometimes they don't feel the pain right away, and they feel it a couple days later. But just because you don't feel pain doesn't mean that there's nothing wrong with you.
Exactly.
So should they come see you right away?
Yeah, definitely. I would come see a chiropractor or any other health professional right away to have a checkup. Make sure, and again, like you said, pain means that there is something wrong, but having no pain doesn't mean that there's nothing wrong.
Okay.
Right.
And is this a myth or not? Can seeing a chiropractor make you taller?
I believe that's a myth. Okay. I mean, in terms of your height, it's really a lot more of your genetics than anything. But it definitely, I mean, if anything, you feel taller because your posture is up. You know that your core is straight, your core is strong, and you have proper posture. Sometimes proper posture will just make you seem taller. So that's really, maybe that's where that myth is coming from. Okay. Yeah.
And back in the day, people used to walk around with a ruler under their shirts just to keep a good posture. So what are some tips that you can have that we can use in a modern day scenario?
A modern day scenario. In terms of posture, I want to focus on to the working population that is having that. I mean, at least about 80% of working population will have some sort of back pain in their life. So I would say one thing is to make sure that like you're always taking breaks. Whether you're standing a lot or you're sitting a lot, you're always taking breaks. Making sure you're walking around, keeping that motion going. And then also one thing, in terms of posture when you're sitting, in terms of your workstation, you want to make sure that your feet is flat on the floor. And your shoulders are squared. You want your chin parallel to the you want your chin parallel to the floor. So you want chin parallel, not too high. So you're right, not too low. You want it parallel to the floor as much as possible, right? And then having a proper chair. Where you can kind of, there's a lot of those ergonomic chairs now, where you can change position, making sure that you can lower the height into that's comfortable. Having armrest if it's acceptable in your workplace. Right.
I feel really elegant right now.
Yeah,
I just wanted
like,
to add that in.
Go like this, and it's pretty much, if you can even imagine just engaging your core. Really, and that's one of the main key for having great posture, is like having a great core, because that really is the one that will support your body and support your back as well.
Great, so keep them abs tight.
Yes, exactly, yeah.
Okay, and that's all the time we have for today. Thank you so much, Jade, for coming in. Make sure to watch us next week, Social Life's in Peel. I'm Bianca Bykhovsky. Thanks for watching.
watching Social Life in Peel. I'm Emily Johnson, and I'm at Sky Zone in Mississauga. It's an indoor trampoline park, and I'm with Jesse, who works here. And can you tell me what type of programs that you run here?
Here at Sky Zone Mississauga, we run a lot of programs. Specifically, I focus on the fitness classes that we offer here, but we also have dodgeball. Birthday parties is really popular here